Let's get straight to it, because this is something I wish more men were told earlier. Especially after 60, what I'm about to share could change the way you think about your own health. I'm Dr. Sophia Jain. I've worked in men's health for over 20 years, and one of the biggest patterns I've seen, something almost no one talks about, is this: men unknowingly sabotage their circulation with one extremely common masturbation mistake. Now, this isn't a conversation about shame or guilt or taboos. This is a medical, physiological issue that affects your heart, your brain, your energy, your sexual function, and your entire sense of well-being. It's something I see again and again with patients who say things like, "Doc, I'm eating right, I walk every day, but I still feel sluggish below the belt. What am I missing?" And it's often this: a mistake that seems harmless, even normal, but is quietly choking off blood flow where you need it most. Let me paint a picture. A man in his mid-60s came into my clinic last year. He was active, fit, still working part-time, but something wasn't right. He told me, "I just don't feel that fire anymore." He wasn't talking about drive or attraction. He was talking about sensation, blood flow, responsiveness. I asked him about his habits, his diet, his medications. Everything seemed reasonable. But then we got to one topic, his masturbation routine, and I knew right away what was happening. See, the mistake isn't that he was masturbating. Far from it. Regular sexual stimulation, even solo, has proven benefits for prostate health, hormone balance, emotional stability, and yes, circulation. The problem was how he was doing it. His technique, the position, the pressure, the frequency, it was all off. And over time, it was quietly damaging the very vascular system he needed to stay healthy and responsive. Here's what you have to understand. Circulation is everything. For your brain, your muscles, your performance, your recovery. And when it comes to sexual function in particular, blood flow is non-negotiable. You need open, flexible blood vessels, strong nerve signals, and steady oxygen delivery. And when that starts to break down, it shows up in subtle, frustrating ways. Less sensation, slower recovery, weaker erections, cold feet and hands, even dizziness when standing up. So what is this mistake that's costing so many men their vitality without them realizing it? It's the combination of poor technique, excessive pressure, and lack of movement. Most men, especially as they age, adopt a routine that's quick, mechanical, and entirely disconnected from the body. They sit hunched over, grip too hard, and rush through the process like it's a task to finish instead of an act to connect with. And over time, this builds tension in the pelvic region, restricts blood vessels, and actually teaches the body to perform under stress, not flow. I call this the clamp and squeeze problem. You grip tight, stay still, and apply pressure in all the wrong areas. That constant squeezing restricts arterial flow and compresses sensitive tissue. It desensitizes the nerves. And worst of all, it teaches your brain to associate pleasure with tension, not relaxation. Think about that for a second. You're trying to stimulate blood flow, but your method is doing the exact opposite. Let's go back to the patient I mentioned earlier. Once we talked through his habits, I asked him to make 3 simple changes. First, he switched from seated to semi-reclined positions to relieve lower back pressure. Second, he lightened his grip significantly, using warmth and rhythm instead of force. And third, he slowed down, gave his body time to relax into the process. Within 3 weeks, he reported not only stronger erections, but better sleep, improved focus, and fewer urges to urinate at night. Why? Because his circulation was finally working for him again, not against him. Now you might be wondering, how can something so private, so personal, affect my entire system? That's the thing, your sexual health is not separate from your cardiovascular health. Your body doesn't operate in compartments. When one area loses circulation, it impacts everything. And the pelvic region, where your reproductive organs, bladder, lower spine, and major arteries meet, that area is like Grand Central Station for your blood flow. When you clamp down on it daily, with too much force and too little awareness, you create chronic tension. The muscles tighten, the blood vessels narrow, and the nerves stop firing properly. That's how circulation problems begin, not just in your penis, but in your legs, your gut, even your brain. And here's another layer. As testosterone begins to decline naturally after 60, your body relies more on stimulation to keep blood flow strong. Without regular, healthy movement through that area, the tissues can begin to shrink, the vessels lose elasticity, and you slowly lose that spark, not from age, but from inactivity. And let me be absolutely clear, this isn't about porn or fantasy or anything external. This is about your relationship with your body. How you treat it, how you connect with it, how you move energy through it. Most men never think about this. They just go through the motions, maybe once a week, maybe once a month, and wonder why their circulation keeps declining. But once you start to shift your habits, to approach self-stimulation with intention and care, things start to change. Let's dive deeper into how this mistake actually rewires your body over time. Because it doesn't just affect blood flow. It alters how your brain responds to arousal, how your nerves fire, and even how your pelvic floor behaves. And if you've been struggling with slower performance, weaker sensations, or a lack of motivation, this could be the root cause. When you use too much pressure, your nerve endings become desensitized. You basically train your body to need unnatural stimulation just to feel anything at all. Over time, this affects your ability to respond during intimacy. I've seen men who can still get aroused mentally, but their body just doesn't respond the way it used to. It's not age, it's adaptation. Their nervous system adjusted to a pattern that doesn't support healthy arousal or blood flow. And when this goes on for months or even years, it creates what we call pelvic tension syndrome. That's a real condition where the muscles in your pelvic region remain chronically tight. They stop relaxing fully. And that tension restricts blood flow, compresses nearby nerves, and creates this low-level pressure that interferes with everything from urination to walking. Men come in with hip pain, groin tightness, even lower back discomfort, and they have no idea it's connected to how they've been treating their body during self-stimulation. This is why technique matters. It's not about performance or fantasy, it's about function. One of the first things I tell patients over 60 is this: switch from pressure to presence. Instead of gripping, try massaging. Instead of rushing, try exploring. Think of it like a form of therapy for your nervous system. Because the truth is, your nervous system can recover, but only if you give it a reason to. Another patient I worked with had stopped all sexual activity after prostate surgery. He assumed he was done with that chapter. But he was having circulation issues, numbness in his legs, a cold feeling in his feet, even erectile trouble. Once we reintroduced gentle, mindful stimulation, not to reach climax, but simply to activate the area, his circulation started to improve. His color came back. He was sleeping better. Even his digestion improved. Why? Because pelvic stimulation wakes up more than just sexual function. It re-engages the entire lower body's blood supply. Now let's talk testosterone. Most people think testosterone only affects libido, but that's just one piece. Testosterone supports muscle mass, bone density, motivation, memory, and yes, circulation. But here's what most men don't realize: sexual activity helps regulate testosterone. When you stop masturbating or do it in a damaging way, your body may start to reduce production. It assumes you no longer need it. And as testosterone dips, your energy, your focus, even your will to move can drop right along with it. This creates a dangerous loop. You masturbate with too much pressure, circulation drops, testosterone follows, and then you feel even less motivated to take care of your body. That's why changing this one habit can break the cycle. It's not about frequency, it's about quality. Even 2 or 3 times a week, done with awareness, can support your vascular health, your hormone profile, and your mental state. I've worked with veterans, executives, farmers, you name it, men who thought they were just getting old, when in fact they were just stuck in a pattern that didn't serve their body anymore. One of them, a 72-year-old jazz musician, told me, "Doc, I didn't know I was squeezing the life out of myself, literally." He had been using the same routine since he was 20. Tight grip, fast finish, no movement. Once we shifted to a more mindful rhythm, his blood pressure stabilized, his morning erections returned, and he said he felt 10 years younger and twice as calm. Let's not forget the mental health angle here. Gentle, slow, Intentional stimulation triggers the parasympathetic nervous system. That's the rest and repair mode. It lowers your heart rate, calms your breathing, reduces stress hormones like cortisol, and boosts your mood chemicals, dopamine, oxytocin, and endorphins. You don't get that same release with a rushed, tense session. That's the difference between relaxation and depletion. If you've been feeling emotionally flat, disconnected, irritable, or down, this might be why. Because without regular, healthy self-touch, you're not getting that hormonal reset your brain needs. And the result is a kind of low-grade burnout. You're not just tired, you're emotionally dehydrated. And this is especially true for men living alone, or men who've lost a partner, or those who think, I'm too old for this. You're not too old. Your body still responds. It just needs better input. Another thing to consider is oxygen delivery. When blood flow slows, oxygen to your muscles and organs drops too. That affects everything: your energy during the day, your recovery after activity, even your skin tone. I've had men tell me they look older than they feel. And when we fix their circulation patterns, their face brightens up, their posture improves, and their gait becomes more confident. That's not coincidence. That's oxygen returning to tissue that had been starving for it. So how do you actually change your routine? First, check your position. If you're hunched over or seated in a way that compresses your hips, you're shutting down circulation from the start. Try lying back, propping your legs up slightly, or using a reclined chair with a soft cushion under your hips. This opens the pelvic angle and allows blood to move freely. Second, reduce your grip. Use warmth, maybe a natural oil or moisturizer, and focus on sensation instead of speed. This allows the nerves to wake up again. At first, it might feel unfamiliar. That's okay. You're retraining your body. Give it time. Third, slow down. Aim for at least 10 to 15 minutes. Think of it as exercise. This is your circulation workout. It's not about release, it's about rhythm. You'll find that as you slow things down, your breath deepens, your tension melts away, and your awareness shifts inward. That's exactly where healing begins. Now let's talk about something a lot of men never connect to this topic: prostate health. The prostate is a circulation-sensitive organ. It depends on regular movement of fluids, relaxation of pelvic muscles, and a healthy hormonal balance. But if your self-touch habits are causing chronic tension or inflammation in that area, it can actually aggravate the prostate instead of supporting it. I've had patients come in with frequent urination, trouble starting or stopping the stream, even pelvic discomfort. Many of them were sure they had an infection or something more serious. But when we did the exams, nothing showed up on scans. What we did find, though, was excessive pelvic tension, poor blood flow, and overstimulation of the surrounding nerves due to years of high-pressure habits. Once we corrected those behaviors, their symptoms eased up, no medication needed. Your prostate isn't just sitting there quietly in the background. It responds to the way you treat your body, especially in moments of arousal. Gentle, low-pressure stimulation helps circulate fluids naturally. It keeps that whole region flushed and oxygenated. But aggressive stimulation, especially if done in a seated or hunched position, creates stagnation, and that stagnation contributes to swelling, pressure, and even nerve hypersensitivity. And it's not just the prostate. Your bladder and colon are right in that area too. When blood flow improves, you get better bladder control, better bowel movements, and less cramping or bloating. All from addressing this one mistake. That's the power of the body. When you treat it right, everything starts working together again. Let's also touch on sleep for a minute. Most men don't realize how much this affects their nighttime rest. When circulation drops, your brain doesn't get the oxygen it needs to cycle through deep sleep properly. That means you wake up groggy, even after 8 hours in bed. You might toss and turn more, or wake up frequently to use the bathroom. And guess what helps reset those sleep rhythms? Regular, relaxing, pressure-free self-touch. Not as a chore, not as a means to an end, but as a gentle release of stress before bed. When done mindfully, it lowers cortisol, increases melatonin, and actually improves the quality of your rest. I had a patient in his late 60s who told me he hadn't slept through the night in over 15 years. We changed his nightly routine, just 15 minutes of gentle pelvic breathing and touch, and within 2 weeks, He was waking up refreshed for the first time in decades. The bottom line is this: circulation is a full body system, but it starts in your habits. Your body will always respond to the signals you give it. And if those signals are tight, rushed, high pressure, and inconsistent, you're going to see the results in every part of your health. But if those signals are slow, steady, nourishing, and consistent, you start to heal. Now, let's say it's been years since you've done this the right way. You might be thinking, is it too late? Absolutely not. The human body has a remarkable ability to regenerate. Nerves regrow, muscles relax, vessels reopen. But you have to give it the input it needs. The key word here is neuroplasticity. That's your nervous system's ability to rewire itself. And it's active at every age, even into your 70s, 80s, and beyond. One of my older patients, a 79-year-old retired firefighter, hadn't experienced arousal in nearly a decade. He figured the door was closed. But when we started working together, I guided him through a new routine that emphasized breath, posture, and gentle touch. He said the first couple of weeks were strange, like learning to walk all over again. But then one morning, he woke up with an erection. A real one. And not only did it boost his confidence, but it also changed how he carried himself during the day. His voice had more strength. His shoulders pulled back. He said, "It's like something inside me turned back on." That's what this is about. It's not just a technique, it's a form of self-respect. Because when you stop honoring your body, it starts to shut down. But when you reconnect, mindfully, gently, with awareness, it comes alive again. Now, let's get specific about what to do. I call this the circulation ritual, and it's something I teach men who are serious about turning their health around. It only takes about 10 to 15 minutes, but it has to be done consistently. Here's what it looks like. Step 1, set the environment. Quiet room, soft lighting, warm temperature. This isn't about fantasy or stimulation. It's about reconnection. Your nervous system needs safety to shift into relaxation mode. Step 2, breath work. Before you even touch your body, take 3 full breaths. In through the nose, slow exhale through the mouth. This activates the vagus nerve and starts lowering your heart rate. Step 3, gentle massage. Start at the lower belly, then the inner thighs, then the hips. You're not rushing. You're waking up circulation. Step 4, touch with presence. Use a warm oil, castor oil, coconut, or jojoba, and let your hand move slowly with no goal. Don't grip. Don't tense. Just feel. If your mind wanders, bring it back to sensation. That's the healing work. Step 5, rest. After 10 to 15 minutes, just lie still. Feel the warmth. Breathe deeply. Let your body absorb the shift. This is when blood flow resets, when hormones get released, and when your nervous system starts rebalancing. Repeat this 2 to 3 times a week, and you'll start to notice changes: more energy, better sleep, fewer urges to rush, and a deeper sense of confidence. This isn't fluff. It's biology. And if you're already seeing signs of dysfunction, weak erections, urinary changes, pelvic tightness, this ritual may be exactly what your body's asking for. But don't wait until it's critical. Start now while your body still has the flexibility to recover fully. Let's take a moment and go deeper into the concept of pelvic awareness. This is something almost nobody talks about, but it plays a massive role in male health after 60. When you lose awareness of your pelvic floor, circulation drops, nerve activity weakens, and control over your erections, urination, and even posture begins to fade. Now, what causes that loss of awareness? It's not just aging. It's disuse. It's the decades of sitting without engaging those muscles. It's the years of stimulation that bypassed your body's feedback system. That common mistake we've been talking about, it shuts down the connection between your brain and your pelvis. And once that connection dims, everything slows down. It's like unplugging the power cord from a speaker. The sound might still be there, but it's weak and distorted. But there's good news. You can reawaken that connection through very simple movements. One of my favorites is the pelvic tilt. Lying flat on your back, knees bent, feet on the floor, you gently tilt your pelvis upward and downward, slowly and with full attention. You're not forcing anything. You're just exploring. 10 to 15 repetitions is enough to bring sensation back to the muscles and nerves that have gone quiet. Another tool is something called reverse Kegels. Most men have heard of Kegels, where you contract the pelvic floor. But if you're already carrying too much tension, that can backfire. So instead, we teach relaxation, the ability to let those muscles go. That's what helps blood flow in. That's what helps you feel again. And again, none of this is about performance. It's about function. It's about restoring your natural rhythm. You see, after 60, your body has a different agenda. It doesn't want quick fixes. It wants real, sustainable flow. And flow comes from relaxation, awareness, and consistency, not tension, pressure, and urgency. Let me also explain something most men never hear about: fascia. Fascia is the thin layer of connective tissue that wraps around your muscles, nerves, and organs. When you engage in years of high-pressure stimulation, that fascia becomes sticky, tight, and restrictive. It limits movement. It restricts circulation. And it creates blockages in the very areas you need open. I had a gentleman come in, 64 years old, complaining of loss of sensation. He said it felt like his body had gone numb below the waist. After doing some assessments, it wasn't nerve damage, it was facial tension. We worked on daily stretching, gentle body work, and pressure-free touch. Within 3 weeks, his sensitivity returned. It wasn't about adding more stimulation. It was about removing the interference. This is why I always encourage men to stop thinking in terms of getting more aroused and start thinking in terms of removing what's blocking me. Because most of the time, your body isn't broken. It's just blocked. It's been overloaded by years of disconnection. And all it needs is space to breathe again. Now let's talk about how this one mistake affects your hormones. Yes, hormones. Because when you overstimulate without relaxation, you don't just mess with your nerves, you suppress testosterone. That's right. High-pressure habits signal to your body that you're in a constant state of stress. And when stress rises, cortisol rises. And when cortisol goes up, testosterone goes down. That's the trade-off your body makes. But when you engage in slow, nourishing touch with conscious breathing, you lower cortisol and support testosterone production naturally. It's like flipping a switch inside your endocrine system. I've seen men in their late 70s double their free testosterone, not with pills or shots, but by restoring healthy arousal patterns. That's how powerful your daily habits are. And don't forget, testosterone affects everything, not just libido. It affects your energy, mood, memory, and even bone strength. So if you've been feeling foggy, fatigued, or emotionally flat, there's a good chance your hormones are involved. And this mistake we've been talking about? It's part of the puzzle. That's why I say this isn't just about circulation. It's about identity. When men lose connection to their bodies, they don't just lose blood flow, they lose their sense of power. Their voice gets quieter. Their decisions become hesitant. They stop taking initiative. And that starts a slow spiral into physical and emotional decline. But the opposite is also true. When you start reconnecting with your body in a healthy way, your energy rises. You speak more clearly. You move with purpose. You walk into a room and people feel your presence. That's what happens when blood moves again, when nerves wake up, when you reclaim your foundation. And you don't need special tools or secret techniques. You just need consistency, awareness, and a willingness to shift. That one mistake, treating your body like a machine, rushing through, applying too much pressure, has to go. In its place, you build a new relationship with your own energy. One that's calm, steady, and deeply nourishing. If you're wondering when to start, the answer is simple: now. Don't wait for a diagnosis. Don't wait for something to go wrong. Prevention is the most powerful form of medicine, and the body responds incredibly fast when you show it care, especially after years of neglect. Start with just 10 minutes, 2 or 3 times a week. Use breath, warmth, and gentle touch. Focus on what you feel, not what you achieve. And over time, you'll notice that your body starts responding again. Your circulation improves. Your mood lifts. Your vitality returns. This is the foundation of male rejuvenation. Now I want to share one of the most overlooked elements in this whole picture: your mindset. Because when we talk about reversing damage, restoring flow, and reconnecting with your body, your beliefs matter. If you're carrying shame, guilt, or embarrassment about your past habits, it becomes nearly impossible to heal. The body responds to what the mind believes. If you believe you're broken, your body listens. If you believe you're too old, your body listens. But if you believe you're capable of restoring your vitality, your body will start to shift in that direction. Let me tell you about a man named Greg. He was 71, recently retired, and struggling with low energy and performance issues. He thought he was too far gone. But when we started talking, I realized his biggest block wasn't physical, it was mental. He had internalized the idea that once a man hits 60, his best days are over. We worked together not just on circulation and hormonal health, but also on his mindset. We replaced self-judgment with self-compassion, and we replaced shame with curiosity. In just 8 weeks, he regained not just physical function, but confidence. That's what happens when you shift the story you tell yourself. So let's rewrite the script. Let's stop thinking of pleasure as a young man's game. Let's stop assuming that decline is inevitable. Let's understand that this common mistake, rushed, forceful, goal-driven self-stimulation, trains the nervous system to collapse instead of expand. It narrows your energy instead of circulating it. And over time, it cuts you off from the very vitality you're trying to reach. What's the alternative? Slow, present, exploratory touch. Not to chase release, but to feel more. To reconnect. To heal. When you engage with yourself this way, something powerful happens. Your parasympathetic nervous system turns on. That's the part of your nervous system responsible for healing, digestion, rest, and deep relaxation. It's the opposite of the fight or flight state that so many men live in without realizing. And once that parasympathetic mode kicks in, your arteries expand, your blood flow improves, your digestion strengthens, and your sleep deepens. And yes, your performance improves too, but not because you're forcing it, because you've created the conditions where the body can thrive. Another thing I recommend to every man over 60 is to create what I call a connection ritual. This is a simple, private, 5 to 10 minute daily practice where you check in with your body. You breathe, stretch, and gently place your attention on your lower abdomen and pelvis. You're not trying to fix anything. You're just listening. Maybe you do a few pelvic tilts. Maybe you apply a warm compress to your lower back. Maybe you just close your eyes and let your breath slow down. The point is, you're showing up. You're forming a relationship with yourself again. And that alone can change everything. You see, for decades, many men were never taught how to be in their bodies. They were taught to perform, to achieve, to get results. But they were never taught to feel, to relax, to allow. And now, at this stage of life, the rules are different. Your body doesn't respond to force. It responds to presence. That's why this shift matters so much. I also want to talk briefly about natural supports. There are a few things you can add to your routine that support blood flow and hormone balance. Things like beetroot powder, which boosts nitric oxide, ashwagandha, which helps lower cortisol and support testosterone, magnesium, which improves nerve function and sleep, and zinc, which is essential for reproductive health. These aren't miracle cures, but they're tools that, combined with daily habits, make a real difference. Hydration is another piece. Most men are mildly dehydrated without realizing it, and your blood is 90% water. If you're not hydrated, circulation suffers. Your body gets sluggish. Your organs can't detox efficiently. So aim for half your body weight in ounces of water per day. And don't just chug it, spread it out. Sip slowly. Stay consistent. Movement is key too. You don't need intense workouts. Walking, stretching, rebounding on a mini trampoline. These are gentle ways to stimulate lymphatic flow and bring blood to your lower body. Even 5 minutes an hour can wake up the tissues that have gone dormant. And then, of course, there's your breath. Shallow chest breathing keeps you in a stress state. Deep, slow belly breathing tells your body you're safe. It's the switch that turns on healing. So as you shift your habits, come back to the breath often. Use it to ground yourself, to calm your mind, to bring energy down into the pelvis. Now, I know for some of you this may sound unfamiliar, maybe even uncomfortable. That's okay. New things often do. But I promise you this, if you try these shifts with an open mind, you'll begin to feel the changes. You'll notice more warmth in your hands and feet. You'll sleep more deeply. You'll feel steadier, more confident, more alive. And the best part? These changes are cumulative. They build on each other. One healthy choice leads to the next. One breath becomes a habit. One walk becomes a lifestyle. And over time, you realize you didn't need a miracle cure. You just needed to stop making that one mistake and start giving your body what it's been asking for all along: attention, awareness, patience, and presence. So to every man listening right now, please know this. You are not broken. You are not past your prime. You are not too old to experience real energy, connection, and strength. Your body is capable of healing, of restoring, of thriving at any age. But you must meet it halfway. You must be willing to let go of the old habits that are draining you. And you must be willing to adopt new ones that restore you. That one mistake, high pressure, goal-oriented, disconnected self-stimulation, was never your fault. It's what the culture taught. But now that you know, you have a choice. You can shift. You can return to your body. You can rebuild your vitality from the inside out. And I believe you will. This is Dr. Sophia Jain, and I'm grateful we've had this conversation. You deserve to feel fully alive again.